Kia ora koutou katoa. Good afternoon, everyone. Before we begin with COVID-related updates and information, I'll look briefly to the week ahead. Tomorrow, myself and Minister Little will have an announcement to make about the review of Farm Act we committed to during the election campaign. On Wednesday, I'll be part of the Local Government New Zealand housing meeting via Zoom. On Friday, I have Cabinet and Cabinet Committee meetings in Wellington with a press conference in the afternoon where we will update everyone on decisions relating to COVID alert levels. As we enter our second full day of alert level restrictions, I know many continue to feel upset and frustrated and angry about the multiple rule breaches that we have seen in recent days that have ultimately led to our current position. I have two things I just briefly want to comment on that are relevant to that. The first is to just give some context. This is not the first time we as a nation have faced this issue. In fact, unfortunately, every time we've had community outbreaks, so back in March and April of last year, and again in August of last year, we have had breaches and we have recovered from them. We have built a COVID management system with many layers and protections for this very reason. We make contact with those who are at risk. We place testing requirements on them. For close contacts, we have symptom and isolation checks, including in-person checks, primarily for welfare needs, but also to ensure compliance. We also use wider restrictions as an extra layer of protection, but we also ask people to follow the rules, to play their part, and we have always done that. Quite simply, we cannot do this alone. The second thing I want to say is this: even with the full understanding of human fallibility, it is not appropriate and it is not okay for members of the team of 5 million to let the rest of us down. Prosecution is a matter for police, not politicians. But it's always been my view that New Zealand's success in beating this virus has been based on high rates of compliance and low rates of tolerance for rule breaking, because we all understand what is required of us. I think this is because we appreciate, as I said yesterday, that this virus can mean life or death. It is a virus that kills. Our plan is for short and sharp restrictions in order to break the chain of transmission, but rule breaking can prolong that plan. So that is why I'm asking everyone, now more than ever, to continue to back and support one another. And if that means calling a family member or work colleague out for not following the rules, then we should do that. Do it with kindness, but do it. Families and communities need to help people do the right thing. On a small scale, this means perhaps offering someone a mask on a bus if you see they're not wearing one. But on a larger scale, it's saying to a family member who you know should be isolating, don't go out. Or saying to a colleague who turns up to work when they should be isolating or awaiting a COVID test result, go home. Return when it's safe for you, for your workmates and the team of 5 million. I want to reiterate that there are support payments in place for people who are isolating, even if the area they live or work in is not at alert level 3 or 4. If you are told to self-isolate and you cannot work from home, your employer or you, if you are self-employed, should be applying for the Leave Support Scheme. The Leave Support Scheme is a lump sum payment calculated to cover 2 weeks. Your employer can reapply for you if you still qualify after 2 weeks. No one should feel pressured to go to work if they've been told to self-isolate. I've also been advised that when someone is identified as being at risk as part of the contact tracing system and is told to self-isolate, we do conduct a welfare check, and that includes checking that people have the financial support and means to ensure that they stay at home. And we can bring in the support of MSD if that is an issue. To reiterate, we have set up systems to help keep New Zealanders safe from the virus, but also safe from financial hardship. If friends or family members are doing it tough, reach out, help them access the support they need. We'll keep doing our bit, but we ask you to help us in ensuring everyone does theirs. I'd like to now move on to decisions taken by Cabinet today in regard to the next group of New Zealanders who will be vaccinated as part of our nationwide vaccination program. This will be a rolling decision-making program. As you know, we are receiving shipments of vaccine that enables us to approve cohorts that then are brought in as the next group that we target. As you know, the first group has been border workers, managed isolation workers, and then we will be moving into household contacts, and we anticipate doing that this week. Household members of border workers is a significant group, which will add about 50,000 extra eligible people to that vaccination program. Cabinet today confirmed that the next group after border workers and their families will be frontline non-border health workers, those who will potentially be exposed to COVID while providing care. We've chosen this group of New Zealanders on the basis they are most likely to pick up the virus through work, but also because it will help to protect against onward spread to other vulnerable community members that they work with. Now, this group comprises around 57,000 people and includes only staff who are at the front line interacting directly with patients. So, those involved in COVID testing, those administering COVID vaccinations, ambulance services, emergency department frontline workers, emergency response diagnostics, community midwives and well child workers who are working in people's homes, general practice frontline workforce that includes GPs, nurses and the receptionists who are dealing with patients, pharmacy frontline workforce, NGOs including whānau ora who are providing first response personal health services, urgent care clinics and accident and emergency frontline staff, and those contact tracing personnel in particular who are dealing with those who may be at risk. We expect to begin vaccinating that group this month, but I should add, you'll be aware that as part of our vaccine program, in order to make sure we have zero wastage, if at the end of a vaccine day we have additional vaccine to distribute, we do access our health workforce and vaccinate them to make sure that there is no wastage once we've taken vials out of the ultra cold storage. So some of that group are already part of our vaccination program as part of that plan. Finally, early evidence looks very promising in terms of the Pfizer vaccine's ability not only to protect individuals from the disease, but also to reduce its transmission. So with vaccination of border staff underway, we are in a stronger position. With that first group better protected, we're ultimately all better off. And so, as a reminder, 1 year on from New Zealand's first COVID case, that in relation to the rest of the world, we are also far better off. But for now, today and this week, we need to push on, do what we have done so well, squash this outbreak, get back to normal life with zero complacency, kindness and teamwork. I'm now going to hand over to Dr. Bloomfield for an update.
Thank you, Prime Minister. Kia ora koutou katoa. So just a few highlights from the media release that went out earlier this afternoon around our community cases and the status of them. So there are no new community cases to report today. As you know, yesterday evening we did report one new case in the community, and that case, Case O, is a household contact of cases I, J, K and L, and has been in the Auckland quarantine facility since the 23rd of February as a precautionary measure anyway. Therefore, for their infectious period, they were in quarantine, so there is no further risk to the wider community and no further exposure events. Genome sequencing is expected on that case tomorrow rather than today because the CT value of the test was quite high, so it needs to go through the longer process because there's less viral material in the sample. There is also one new case of COVID-19 in managed isolation to report today. So yesterday evening, we did also report the preliminary whole genome sequencing result for Case N, that is the mother of Case N, and that shows that it is a similar genomic sequence and therefore linked to the current outbreak as well. Contact tracing for both those cases continues to be a focus for our public health staff in Auckland, and all other household members have actually now been transferred to the Auckland quarantine facility for observation. The dates and times of potential exposure events are on the Ministry's website at the Locations of Interest page. That page has specific advice for people who were in particular, at all those locations, but in particular at the Manukau Institute of Technology campus. And I've just got an update on the follow-up of people from that setting and from the gym. So there are 21 close contacts identified as classmates or a teacher of case N. All have been contacted. They go and remain in self-isolation for 14 days. They are on testing twice during that time and daily contact to check for symptoms and ensure, of course, that they are in isolation and have all the support they need to remain so. There are 21 casual plus contacts identified and all have been contacted. This is from the student centre or the cafeteria on the days in question. All, as I say, have been contacted and are required to get a test and isolate until that test comes back. Again, if MIT students and staff can check our website for the dates and times that are pertinent, then they will be able to see if they were in the student centre or the cafeteria at that time and should identify themselves through calling Healthline. There is also a number of casual plus contacts for KCM from the gym that was attended last Friday. There are 154 of these people. All have been contacted and they are advised to get a test and isolate until such time as it comes back negative. The remainder of people from the Manukau Institute of Technology are deemed as casual contacts, and they, of course, are under the same restrictions on movement as the rest of Auckland under Alert Level 3 and are asked to monitor for symptoms and immediately seek advice about getting a test should they develop any. I can also confirm that there are no close contacts of KCM who have left Auckland since the exposure, that event that they may have been part of. And I can say that our public health units do use both finder services and the police to support them to find people who cannot be contacted. So far that has not been a problem. And likewise, our Māori and Pacifica and community-based providers are already visiting homes of people isolating where they may need support and making sure they have everything they need to remain safely isolated. I can tell you that our first 3 cases, A, B and C, have now been deemed to have recovered from their infection and have now left the Auckland quarantine facility. What to do if you've recently been in Auckland? Overall, everyone should, of course, follow the alert level guidance for where they are staying. Auckland is currently at alert level 3, the rest of New Zealand at alert level 2. For those who may have been in Auckland recently, just check the Ministry's website to make sure you are not caught up in one of the locations of interest. If you have been, then please follow the instructions on the website. Anyone around the country should, of course, be alert to symptoms of COVID-19, including this more recently prominent symptom of muscle aches and also just general fatigue and tiredness. Keep a record of where you've been, wherever you are in the motu, and use the COVID Tracer app. The important thing about Alert Level 3, it is designed to restrict movement and restrict interaction between people. That is an incredibly helpful and important tool in us getting around this outbreak. For testing, there are 10 testing stations in Auckland today. There are waits at some of them. At 12:30, I understand that the ones in South Auckland may have had around a 1.5 hour wait. I'm expecting that will improve during the day. What I would say also is that about 60% of our swabbing in Auckland happens through general practices and urgent care clinics, actually most of the testing, or the majority. So please, people do know that you can go and get a test at your GP or at an urgent care clinic, and wherever you get a test, it is free, of course. Finally, I do know people will be finding this tough, particularly in Auckland. Some people will be anxious, some people will be at home alone. If you do need support, don't forget that we do have the 1737 helpline, and there is a range of other supports available on the Ministry of Health website. I did say it was my final comment, but I also just want to say that our vaccine program continues to roll out without missing a beat, and we're keeping in close touch with the Auckland DHBs and the team doing the rollout there to make sure that they have everything they need to keep vaccinating our border workforce, and we are so far on target for being where we anticipated we would be. Thanks,
Dr. Bloomfield. And I understand that we'll be giving a vaccine update, as we've said, weekly, so that will be happening on Wednesday. Now, open for questions. Jessica.
Prime Minister, with the numbers that we've been getting out today, we've had the 154 contacts at the gym, for example, at MIT. What does that tell us about how widespread this could be? Are those numbers larger or smaller than expected?
Look, we always anticipated that with someone who had an entire week of exposure events and the nature, even before we'd dug down into close contacts, the nature of those venues would mean that there would be larger numbers of people involved. We anticipated that. And that is why we're in this current 7-day time frame, because we knew the scale would be larger than perhaps previous contact tracing events where we haven't always had large education institutes and so on.
Can you also outline why it took so long to figure out that case N with the mother was linked to that second family?
Happy to run through the timeline. Jump in, Dr. Bloomfield, if I miss a detail here. So, of course, on Sunday we were, Saturday advised of that first case. We then immediately go in and test the other family members. So in that tranche of family members, we then identified that the mother was also infected. We then go in and contact trace. You will have heard that initial suggestion yesterday, so on Sunday, that we'd at that point identified a potential link between the families. And then late yesterday afternoon, we confirmed the timeline that has been what has occurred, because we got the details of the contact, the timeframes, symptom onset, and the genome sequencing, which confirmed it. So it actually happened in reasonably short order.
Why did you not know about the contact?
Why did we not know about the contact?
Why wasn't that listed initially with those families?